This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions.
Hello, I'm so grateful that you chose to listen to this podcast. I'm Dr. Judith, a board-certified psychiatrist and researcher. And on this podcast, you will hear from world-renowned experts. At the end of every single podcast of The Vault, every expert talks about a time in their lives when they were struggling and no one knew it. And they talk about what they used to get through that struggle. So make sure you listen through till the end and you subscribe and share with a friend.
Dr. Kudzai Dombo is a distinguished board-certified obstetrician gynecologist. Dr. Dombo's initial inspiration was her father's internal medicine practice in Zimbabwe, where she observed firsthand the respect and impact her father had on his patients, particularly at a time when women's voices in Zimbabwe were often marginalized. Over the last 2 years, she has committed to caring for women in midlife and through the menopausal transition. And here we are with menopause. I go to events, and I don't know about you, but I'm always looking around the room like, where are the Black people? You know, why aren't we at these events? And Black women have menopause and perimenopause sooner, longer, with more severe symptoms. We need to be filling these spaces, but we're not in these spaces, right? And so when I heard about the initiatives that you and your organization and the doctors in your organization, like Dr. Sharon Malone, are working towards to empower Black women to figure out how to provide appropriate care for Black women, I just thought, you know what, let me just yell this from the rooftops or in podcast terms from my mic, right? And socials, because more of us need to know about this. So
one of the things that I look to and see is historically Black communities, there's a level of mistrust, right, with the medical system, not really knowing for sure, hey, is this truly for me? Is there something behind this? And so being able to be a source of information that is not only accurate, but also, from a trusted source, I think it's really important. And so that is going to look like meeting women where they are, right? Being able to ask the questions, hey, what is going on? What are your thoughts? What may be a barrier for you? Because before we even think that let's just show up and be there for Black women, I think it's so important to understand where they are. Everybody may be in a different space. It may be, I heard something, my girlfriend said this, my grandma said this, and these are pieces of information that we hold on to and pass generationally. But I think it's so important to be a space where women can feel, especially Black women, can feel comfortable.
She works with Alloy Health as a prescribing physician and became the director of advocacy and outreach. Alongside Dr. Sharon Malone, she launched Alloy Health's initiative for Black women's wellness. On this episode of The Vault, Dr. Dombo discusses how Black women can take care of their health in midlife by learning about the higher cardiac risks and more severe menopause outcomes that they experience compared to other groups. Yet Black women are the least likely to get treatment and support and are often excluded from the menopause conversation. Dr. Dombo, thank you for being in the vault with me.
Oh, thank you for the invitation. It's such a pleasure to be able to be here.
It is a pleasure, and we have so much to talk about. I want to get through all of it, and sometimes I don't even know where to begin when I have this many questions. I don't even know where to begin. But we were talking last week a little bit about some of the initiatives that your organization has, and just the historical implications of why Black women seem to be the last people at the table when it comes to certain health issues, right? Like we were the last people to talk about, sexual health, because of the taboo. We're often late to the table with regards to things like postpartum care and, maternal care. And we have the highest rates of mortality, right? And here we are with menopause. I go to events, and I don't know about you, but I'm always looking around the room like, where are the Black people? Why aren't we at these events? And Black women have menopause and perimenopause sooner, longer, with more severe symptoms.
we need to be filling these spaces, but we're not in these spaces, right? And so when I heard about the initiatives that you and your organization and the doctors in your organization, like Dr. Sharon Malone, are working towards to empower Black women to, figure out how to provide appropriate care for Black women, I just thought, you know what, let me just yell this from the rooftops or in podcast terms from my mic, right? And socials,
Absolutely.
Because more of us need to know about this. So tell us about that. Why is it that we're not included the way that we should be in these conversations?
Yeah, great question, Judith. I think one of the things that I look to and see is, historically, as Black communities, there's a level of mistrust, right, with the medical system, not really knowing for sure, hey, is this truly for me? Is there something behind this? And so being able to be a source of information that is not only accurate, but also, from a trusted source, I think it's really important. And so that is going to look like meeting women where they are. Right? Being able to ask the questions, hey, what is going on? What are your thoughts? What may be a barrier for you? Because before we even think that, let's just show up and be there for Black women, I think it's so important to understand where they are, right? Everybody may be in a different space. It may be, I heard something, my girlfriend said this, my grandma said this, and these are pieces of information that we hold on to and pass generationally. So there can be that aspect, but I think it's so important to be a space where women can feel, especially Black women, can feel comfortable coming and asking the appropriate questions, being able to be heard, being able to be seen, and not dismissed. I think sometimes also engaging with the medical system, Black women may feel like they don't want to be portrayed as the angry Black woman, when it comes to some of the symptoms that they have. If for whatever reason there may or may not be bias, and it can be that, they may feel minimized, their symptoms are just, that's not that bad, right? I think it's just so important that knowing these statistics, right, there is some way to address the issue because, as you said, Black women are more likely to have a diagnosis of high blood pressure, diabetes, being overweight, as well as cardiovascular disease. They have a 30% higher chance of cardiovascular mortality than, their Caucasian peers. So I think looking at all of that, we've got to create a way that we can not only, again, provide a space for information, provide a space for access, and then also provide a space where our doctors have been trained in cultural competency. Because when you look at the individual, it's also their socials. It's not just the person, but all the other aspects that come with, the individual who's in front of you. So I think we really are, our goal is to, create a space that works for Black women to know what resources they have at their disposal, have the access, and also know that this is a place where you can come to feel seen, heard, understood, and we want to work with you.
And also there's that added stigma within our community, right? Because there's that trope, Black don't crack. And a friend of mine who's also a physician, and she's a dermatologist, she'll say, Black don't crack, but it does sag, but it does get ashy. There's a lot of things that happen, right? And yes, our skin is beautiful. Yes, we have melanin. And it doesn't take away from, the saying two things can be true. You can have beautiful skin that appears much younger than it is, but on the undersurface, there are factors that are, different than what we see on the surface. There are factors that put us at risk for sooner perimenopause, sooner menopause, because we are a highly traumatized people. We go through systemic bias every day. We show up to work and there are microaggressions. There's generational trauma. There's lack of access to care. There's the added burden placed on us when healthcare professionals don't believe us or they minimize our symptoms. So there are all of these factors to take into consideration that we need to know about. But if we don't know, right, and if we're taught that, well, we're not supposed to crack, then there's going to be shame. Like, why am I cracking? I'm not supposed to crack. And also, you know, across the board, there's just not a lot of information about perimenopause and menopause. So that's that added barrier to access to appropriate care, because you are a woman. You're not just a Black individual. You are also a woman. And 100%. So tell us about some of the, you know, you mentioned cardiovascular disease, and I don't think a lot of people know that there's this connection between menopause and heart health. And I think a lot of people are starting to really take heart health seriously. I remember in the 90s and the early 2000s, it was a boom about getting women checked and so forth. But tell us about that unique link between heart health and menopause.
Yeah. So one of the things that happens when you go through menopause is your estradiol levels decline. And with that, the protective effect, on your blood vessels, we noticed that if within the first 10 years after menopause and before the age 60, if you supplement estradiol, right, for symptoms, your symptomatic relief, you tend to have a cardiovascular protective effect of estradiol. So starting is really important when you start hormone therapy, if that's a choice you choose to make, within the first 10 years from your last menstrual period, as well as before the age of 60, that has a significant impact on your cardiovascular disease and your risk factors for cardiovascular mortality. And as you know, one of the number one cause of death, in women is cardiovascular disease. And it's 30% higher for Black women. Wow. Say that louder. So 30% higher for Black women, and so, anytime I see a Black woman fanning herself in church, for example, fanning herself, one of the things that I feel a personal commitment to, pull them aside. Hey, sis, do you know that you don't have to, this is not something you have to endure. And knowing that there is the link between your hot flashes, the number of hot flashes, and the impact on your heart, that is something that most women aren't even aware of, that the degree of severity of your hot flashes is directly linked to your risk for, cardiovascular disease. And so it's really important that women are educated about this. They know about this so that they can make an informed choice. I mean, this woman at church who I saw it took a few months because she was not aware. It took a few months. She made an appointment with her doctor at Kaiser. And, a few months later, she started on estradiol, a little bit of a bumpy road in the beginning, right? Because, her body had not been exposed to estradiol for a while after she started on the estradiol and progesterone. But now she sees me at church and she's like, Dr. Dombo, or she calls me by my first name, because we're friends. But she's just like, Kudzai, thank you. Thank you. Because not only do I feel better, but I want to be here for my grandkids, right? I want to be here to be able to care for them. I want to age well. I don't want, numbers or statistics to be something that I'm looking at for my personal, health history. Wow. So it's really important to me to be able to hear and be able to be an advocate for letting Black women know that not only is it about the symptoms, but I'm talking about your long-term, your health benefits.
And I think that if more people had access to stories like that, stories that are more like a testimony, right? I think they would apply that to themselves, because what I face, not only with people in the community, with patients, but also within my family, are people who are like, well, I heard about this herb, I heard about this supplement, like why I'm going to be put on hormones. There's, so-and-so said that this works. And then you before you know it, the person's on this tea and this, not that there's anything wrong with that necessarily, but it's not addressing the very real risk of mortality. So what would you say to someone who is skeptical, who's like, well, my mom treated it with this, or I know so-and-so did this, and that it's not evidence-based, but people aren't trying to hear that. How would you approach a patient like that?
Yeah. And it's interesting you say that, because I actually was in a group here in LA of women who I was invited to, just give a brief talk about my own personal journey. And this was, she was a menopause coach, and she had a community of, and it was a very diverse community, but a lot of Black women. And I remember, within that time that I got to speak, there were some women who felt like, you know what, this is what I'd rather, use something that's natural, and then you know what, a month later, knocking on my door with an appointment, I've tried it all, and it's not working. And what you had to say actually resonated, and I'm willing to take the next step. So I really think it's important to speak to groups of women, especially in community, because you are going to have some women who do not want to for whatever reason, but then you're also going to have women who are on, hormones. And I think within a space of community, there's the ability to be able to be like, wow, you know what? I heard her story. I heard her story. You know what? It's time for me to go ahead and do this. So that's where I think the important thing is meeting women where they are at. And I've learned that just from, my experience working, overseas globally. You go into a community, whether it's in Sri Lanka, Cambodia, El Salvador, the first thing that you need to do is meet people where they're at, because you can have all the resources, all the answers. You can know exactly how to take care of them. And it can be a shock when they tell you, no, I need to go talk to my family first. Right? Because culturally, that is how they navigate the health system. You know what? And you know what I find? They eventually come back and they're like, okay, we're ready. So I think that's why I think it's so important to meet people where they are, because even if somebody says to me, you know what, I'm just going to try the teas, I'm going to, and I'm like, okay, but just so that, I'm here for you when you need me. I think that invests way more trust in somebody eventually saying, you know what, I've had some time to think about it, and I think this is the way that I want to go. So I'm never the person who's going to tell people, oh, you're doing the wrong thing, or you're making the wrong decision, right? But it's just, hey, I'm here when you need me.
For me, like in psychiatry, we're often taught, don't share too much about yourself. Don't, the patients, you have to be a blank slate. The patient will feel that you're imposing. But I find that when you strategically share a little bit about yourself as a healthcare professional, it can be so powerful, because that could be the difference between a patient trusting you and not trusting you. And as someone who does clinical research in dementia, I kept seeing woman after woman in clinical research studies with Alzheimer's dementia. And I remember speaking with a family once, and I said, my grandmother has dementia, has Alzheimer's dementia. And when I visit her in Tobago, and she says, hey, Judy, were you here yesterday? And I'm like, Granny, I haven't been here for years. It strikes a chord for me. I'm like, I never want to be forgetful of my grandchildren. I don't, and that to me led me to want to learn about, okay, how do I minimize my stress? How do I protect my brain? And I started learning about how menopause is tied to dementia. And so I think that's another thing people don't know, that in Black communities, dementia affects us disproportionately. We don't get access to care. We have more diagnosis, earlier diagnosis. It's just, something we don't even think about because we don't know. So can you please break that down for us, that link between menopause and dementia?
Yeah. So when you go through menopause, your estradiol levels, as I said, go down. And estrogen is one of the hormones that's very important in facilitating the synapses in the brain, making the appropriate connections. So especially for Black women who encounter menopause at an earlier age, right, than our Caucasian counterparts. Average age of menopause is 51. So Black women encounter it 1 to 2 years earlier. I see Black women as early as 45, going through menopause. And so the longer you go without that estradiol, right, it will impact cognition. A lot of people start noticing that they get forgetfulness, they get a lot of different symptoms of memory. But I think especially, the earlier onset of menopause, that has a direct link to Alzheimer's. And when it comes to Alzheimer's, you think of the burden on the other generations when it comes to long-term care, right? And so I think it's so important that women are aware that, again, it's not just treating your symptoms. The more hot flashes you have, the more impact it also has on your brain and your risk for dementia. So it's very, very important to make sure that when you think about the right now, you're also considering down the road the long-term impact. Because I think, as you said, as Black women, we carry a lot of an allostatic load or weathering, right? We carry a lot of stress. And so not only does that impact why we end up in menopause earlier, but I think it's also important to understand that, the long-term the long-term risks, when it comes to dementia are also there. And when go through dementia, it also has an impact. It's like a negative loop. It has an impact on the generation below. And those women who are also going through stress are now also caretaking, right, for the older generation, and then also their kids, and then maybe their grandkids. And so it just becomes this vicious loop. And when we're trying to look at breaking that loop, I counsel all my patients that, it is important stress management. It is very important having an exercise that you are doing routinely to manage your stress, because stress can increase your cortisol levels. Cortisol levels can also your estradiol goes down. That also increases cortisol. Inflammation in all parts of your body, including stress, it's just, a recipe for just overall long-term chronic illness. And I think it's just very important as Black women that we can break this. We can break this cycle.
I'm glad you brought up stress, because people don't know that the highest rates of trauma are in the Black community. And if you think about that, trauma doesn't just impact your brain. Trauma impacts your body. It impacts your relationships. It impacts your earning level. It impacts, where you go to school. It impacts everything. There's a very famous study, the ACEs study, the Adverse Childhood Events, that trauma can wear and tear so much that it impacts every aspect of your life. And also people who are highly traumatized have worsened symptoms of menopause. So all of this is information we need to know. And many times we go to the doctor and we're like, I'm tired, I'm moody, I'm forgetful, I feel up and down. I don't know who I am anymore. And instead of us getting appropriately diagnosed, we're given an antidepressant and told to come back in 6 weeks and report on how we're feeling. If we only knew that, Black women go through perimenopause sooner, that we should be looking for these signs in our late 30s, early 40s, then we would know how to ask for the appropriate care, because we can't let the onus be on the doctors anymore, because doctors only get like one course. So we have to educate ourselves in menopause health and say, Doc, nope, because you didn't ask me about my physical symptoms, right? You didn't ask me if I'm feeling hot. You didn't ask me about my skin changes. You didn't ask me about my hair changes, my period changes. You didn't ask any of that. You just thought it was all a mental health issue. But we need to know that this could be an early sign of going through the menopausal transition. And I wonder if you could share a little bit about, what you went through when you started realizing that you were in perimenopause, and how that was like a light bulb in your head. Like, wait, I need help too. Because many times as clinicians, we don't know. We're used to prescribing and describing and others. But when it comes to ourselves, we're just like, we're shocked. And I know I went through that with high functioning depression. I was so busy diagnosing everyone else that I was like, wait a second, I think I'm depressed. How did I miss this?
100%. I just want to say something really quickly to what you mentioned about being a practitioner who takes care of Black women in midlife. I think it's really doing Black women a disservice not knowing the statistics, right? Because this isn't just about, I'm presenting with a symptom. You're looking at a bigger picture, that comes with what it is that they're at risk for, how you can improve their long-term health. And the argument is there more to prescribe something for them when it comes to like even a transdermal or oral estradiol with progesterone. There is a greater argument for it than against. And that is what I think we're really trying to impart, is that it's not about forcing women, but it's also not about, it's simply about the argument for versus against. And that requires knowing what the statistics are for Black women and being able to take care of them and providing them with the best service possible for them during this time. Mm-hmm. So going back to your question about my own perimenopause journey. So it's so interesting because as an OBGYN, I would have thought I was better prepared for, this transition. I happened to do my residency during the WHI in 2002 is when it came out. I started my residency in 2001. And so what I recall, leaving residency with was that hormones are just not something that you prescribe patients who are going through menopause or perimenopause unless it is absolutely necessary. Like that is the thing of last resort. Okay. So again, full-time OBGYN for it's been almost 20 years now. But I was at the time, this is about 2.5 years ago. I had started I was 24-hour shifts in the hospital and pretty much exclusively doing hospital gynecology. But I was also doing part-time perimenopause and menopause care, telehealth, consulting. I, had an opportunity. Somebody had said, hey, we're looking for doctors. And I jumped on it because friends of mine had been asking me, questions about it. We were all of that age and I just had to tell them, go find a doctor, because I don't know anything about, go find somebody who can help you. Right. But then, when I started doing a little bit more research and this opportunity came about, I kind of jumped on it. And then I started slowly but surely getting more comfortable, taking care of women, during this stage of life. And really, I got excited about learning about it, So I've been doing it for about a year. And I realized that, friends, family, colleagues, they were all coming to me because I was so excited about it. I was so excited about caring for people. So they would come under my care. And I think, I believe I was 49 at the time. And I remember thinking, I probably should be thinking about this. But I think as the daughter of immigrants, what that signaled to me specifically was that if I were to go on hormone therapy, I'm basically saying that I have ended this particular chapter of my life and I've transitioned over to another chapter. I got married at 47, frozen my eggs. So I didn't want to close any doors, but it was really interesting because I made it mean that if I go on hormones, there's absolutely I'm shifting, into a different space of a different chapter in my life. And so it was very strange because I counsel women all the time about, hey, if you're in perimenopause, you can still get pregnant. So despite all of that counseling, I still kind of did not make any kind of connection for myself. So I started learning everything, started learning about supplements. I wasn't ready for hormones. So, I realized, let me try some turmeric. It was just one of those where it was kind of like an experimentation. But what really started to happen, and this is where I truly realized that something was really off, was that I started to find that I couldn't tolerate very stressful events. So one in particular, I had one of my best girlfriends. She was at my wedding. There was a breakdown in our friendship and, we weren't talking, and I, was trying to mend it, try to repair it, but it just wasn't happening. And normally I would be like, okay, well, you just kind of keep it moving, but I had such a difficult time managing that. I also, again, had been married for maybe 1.5 years, 2 years. Mood swing. My husband was like, who are you? Who did I marry? Mood swings, irritability. It was rough. It was really rough. And I think I kind of thought, I knew that something was off and something wasn't right. But what really tipped me off to there being even more to this was that, I started not being able to sleep. And for me, I prided myself on being able to sleep on a rock, right? 24-hour shifts. If I get the chance to take a nap between patients that are pushing, right? Head on the pillow, I'm out until the nurse calls me and says, ready for delivery. But even with that, 3 hours or so that I had, like at 3 a.m, between 3 and 6, I couldn't sleep. Or if I did finally get to sleep, a nurse would call me and I couldn't go back to sleep again. So I would start getting annoyed. And so really it was like my sleep got so impacted. It was so annoying and frustrated. I tried magnesium, I tried melatonin, I tried a combination of the two. At the farmer's market, somebody's selling moon milk, I'll try it, So it was like literally, because you get to a point where
yes,
I'm willing to try anything. I'm willing to try anything, even moon milk, Yes. And so,
wait, what is moon milk?
So there was this Ayurvedic, booth, at the farmer's market, and it had a combination of saffron, it had ashwagandha, it had turmeric, and what you do is you put it inside either, you warm up almond milk, you put a teaspoon of that in there, you drink it before you go to bed, and that's supposed to kind of lull you into sleep.
That's great branding. I love the name.
Yeah, I know. So when I hear moon milk, I was like, oh yes, that's for me. I'm going to try that. And so, and what I found was that, things may work for a little while and then it just doesn't work anymore. Works for a little while, doesn't, work anymore. And so it's funny because I was talking to my sister, and she is a year and a half younger than me. And I was taking care of her perimenopausal symptoms. She was already on hormones, right? And so I remember telling her how just frustrated I was with life, and I was feeling depressed. And and I'd made an appointment with a psychiatrist. I found somebody to see, here in LA, because I was like, this is like the lack of sleep. Literally, it just clouded. Imagine working a 24-hour shift. You come home, you want to take a nap, and you can't. You're like, and it's very deeply distressing. So again, impacting relationships, job. So I made an appointment with a psychiatrist, but I had this conversation with my sister, I think it was maybe a week before. And she was like, are you sure that might not be your hormones? And again, coming from a trusted person in my life, I said, okay,
is she a doctor?
Here's what I'm going to do. She's not. She's a physical therapist.
Okay.
But I said, let me try it for a month. Okay, I'm going to give myself a month. It's not committing me to anything. I'm going to just use the patch. And this is what I prescribe to my patients. I'm going to try the patch, talk to my husband about it, progesterone, and I'm going to still, and I'm going to see. So 4 days after starting, the sleep had improved.
Wow.
My mood, it was almost like a cloud lifted. And I felt the energy, because it was truly also an issue of having no energy to do the things that I enjoyed, right? So I still had the appointment with the psychiatrist, and I said, you know what, I'm going to keep it, because this could be maybe it may work for like a week or two, and I may go back to the same place. So I ended up keeping it, and I went to him, but I didn't feel like I really needed anything. But we spent the whole 90-minute initial evaluation. I felt like I was educating him on perimenopause and menopause, because he had no idea.
Yeah.
And, and so it was one of those things that it was very validating for me, to know that, okay, I don't need him to do anything right now. He said, well, I'll stay in touch. Let's follow up, because we don't know how you're going to do in 3 months. But I think what was so important is that I started it then, and I never stopped, because it really made a huge impact for me. Wow. When I tell you the distress, that I experienced being able to go to work and function, there was a huge impact, and it made me isolate.
Well, the thing that you said that I think I didn't know, because I'm not a hormone doctor, and I clearly didn't learn it in medical school. But you said something like, once you start hormones, you don't have to worry. You can still have a child, right? You can still, try to conceive. And I think people do equate starting hormones for perimenopause and menopause as oh, that's the end for me. That's the end of fertility for me. That's it. But I don't think people know that. I don't think people know enough about that. So what are some of the other myths about starting hormone therapy, like that you think people don't know that they should know?
Yeah. Well, I mean, the truth of the matter is, once you hit age 40, right, your fertility starts to decline. Okay. However, it is not impossible to get pregnant, while you are on hormone therapy for menopausal hormone therapy, which is also known as HRT. So I counsel all my patients that, hey, if you do not have a form of contraception and you do not want to get pregnant, it's very important that you use some form of backup contraception. Are the chances high that you'll get pregnant? Probably not, because you're already dealing with hormonal fluctuations, but it's not impossible. And so I think it's just important to know that, again, it isn't the beginning of the end. What it truly is during perimenopause is support for your symptoms. We're providing just that little bit extra, right? To make those fluctuations that are happening during perimenopause a little bit more stable. And
then the other myth is the cancer, right? There's another myth that it puts you at risk for cancer.
Correct. And that's not true. It does not increase your risk beside your baseline risk for cancer as it is. So it is important that you are getting your screenings. The American College of Obstetricians and Gynecologists recommends at least every 2 years after the age of 40. So it is important that you are looking at what your baseline cancer risk is. But hormones in and of itself, like estrogen and estradiol especially, does not increase your baseline risk of cancer, of breast cancer. And it can be protective of other cancers like colon cancer, so it's really important to statistically know, hey, colon cancer, it's found that it really reduces your risk for colon cancer.
And then another myth is that I've heard that people are worried that it causes weight gain because, they equate hormone therapy to when you take your oral contraceptive and you can gain weight. Can you please tell us about that myth?
Yeah, I can speak to that. So the amount of hormones in menopause hormone therapy is a fraction of the amount that's in the birth control pill, even comparing it to the low dose birth control pill. So knowing that the amount of hormone is significantly less, any experience you may have had with the birth control pill it may be very different. One thing that I do tell patients, though, is it may take your body a little bit of time to adjust to estradiol or progesterone. And sometimes the body, in its, response to the introduction is that you may have some water retention. The beautiful thing about that is it levels out as your body adjusts. So it's not something that will stay or it will stick. It can be very scary to patients when they feel like, oh my gosh, the number on the scale is going up. But what I try to really reassure them is that this is water retention and this is just your body. I don't like to use the word freaking out, but your body is just reacting in a way that once it gets adjusted, you will, release all this, water retention that can occur once you start. So it's a possible side effect.
And, what you were saying about those risks, being in Black women, are there other groups that are more likely to have worsened symptoms or earlier symptoms in addition to Black women?
Yeah. So I think Hispanic women also have been, the SWAN study that came out it was started in 1996 and it was, almost, 2 to 3 decades, of information that was collected about women in midlife. And it looked at all the different, ethnicities. And I think one of the things that they picked up is for Latino women, the more prominent symptom, they have, also, prominent symptoms, but more the vaginal symptoms. So like the vaginal dryness, the genitourinary syndrome of menopause, they found that amongst Latino women, that was a way more common finding that, across the board.
Wow. That is so interesting. I think people don't know this, and especially Latino women are seen, they're hypersexualized in media And then imagine you're being hypersexualized, and then then you go through periods where it's difficult to have sex, what that does to you, right? And to your image and your identity. So you don't want to talk about it because you feel shameful. You feel as if maybe there's something wrong with you. But if you knew that it happened to many people in your group and it happens at higher rates, then you know it's not your fault. This was so empowering, and I'm so excited about the initiatives that your company is going to be offering. Can you tell us a bit more about that? Your story, first of all, let me thank you for your personal story. It was so vulnerable, and I truly do believe that is what really helps people to feel connected and to ask for help is the stories. So thank you for sharing that. And please tell us about your upcoming initiatives.
Yeah, so we're doing the Black Women's Wellness Initiative. And one of the things that is really important to us is that we empower women, right? Not always do we need to actually educate them, but in times where they need education, that's fine. But some women already have that information. So I'm not coming in saying, I'm going to educate you all. It's really to empower you, right? And the goal is to know that you have resources available from, trusted source, where we really want you to know that we are willing to provide you with the knowledge, and it's also from a trusted source. And I look at all the work that Dr. Sharon Malone has done as well in her, not only, the book that she wrote, but she also, for all the prescribing physicians, she's our chief medical advisor. So she has been instrumental in pushing the needle, when it comes to reasons why it's important to prescribe versus, the fears that sometimes we have as physicians who have really had PTSD from the Women's Health Initiative. She has been such a champion for giving us reason why, going over specific cases, specific patients. So that is one thing. We really want to be able to empower women, that there are resources. We also want to provide access, and let patients know that, we are here, we are a telehealth platform. So no matter where you are, we are available, and you can log on, and you will get, a response from a doctor within 24 to 48 hours of filling in your intake. And the other thing is that we're committed that every woman navigates, this transition with confidence, with clarity and with ease. We think women deserve that. Black women deserve that. And so this is really just about providing that, compassionate, expert inclusivity when it comes to care, and our commitment to, the women navigating this with confidence.
And I usually end my podcast asking about a time when, people thought things were put together, but you were struggling. But I just had to hear your story in the middle of the podcast instead, because I think it's so powerful. So I didn't want to wait until the end. But I also want to add to the fact that, Black women need Black doctors. We need to see a doctor that looks like us, who isn't talking at us, who we can relate to, who cares about us. And many times, the research shows that a Black doctor is that individual. And we see the numbers. Our Black doctors, the number is shrinking. There are initiatives that are closing that are going to make it difficult for us to adequately represent our community. So I am so grateful that your company has Black doctors, Black women physicians leading this initiative, because I think that is going to be the most powerful aspect of what you're doing, because Black women are going to want to listen to Black doctors, period. So thank you so much for being in the vault and on my podcast. And where can we find you? Where can we follow you? Where can we learn more about your upcoming initiatives?
Yeah. So you can come to my Instagram at myalloy.com. You can come find me at Dr. Kudzai MD on Instagram as well. And that's really at this point, as we roll out, we'll have way more information to offer everyone as the momentum continues.
Thank you. I really appreciate you. Thank you for listening to this podcast. Make sure that you subscribe. When you subscribe, it helps me to continue to deliver this mental health information for free to millions of listeners. So Please support my mission. Please pick up my book, High Functioning, and let's build a happier life together.